Thousands of nurses are on strike across the United Kingdom.
The two-day walkout comes as Britain struggles with an already overburdened healthcare system. The strikes are expected to impact roughly a quarter of the hospitals and clinics in England. With little progress being made during negotiations in recent weeks, there are questions over how long these strikes could last.
Joining us now to discuss this is BBC correspondent Sean Dilley. Sean, thanks for connecting with us. You know, we've referenced the healthcare system there as overburdened. And so that gives us a sense of what nurses and doctors have been going through, certainly during the pandemic. But just spell out for us what nurses are asking for in order to return to work and why they aren't getting what they need.
Certainly will do. In just a few moments, we'll actually hear from an emergency department doctor. You may recognise his accent for the majority US viewers out there. But this isn't just about one day. This isn't just about one action. We're going to just have a quick look over the road. This is opposite Downing Street, where the Prime Minister is based, and the Department of Health, where Royal College of Nursing union members, among others, supported by other unions, are saying that the 4.75% pay rise awarded to nurses by an independent pay review body that looks at national health pay is not enough to attract new nurses. It's not enough to meet minimum staffing levels where wards are short of nurses, because they say it's not a very attractive system. You've got to remember, of course, two very different health systems, that of private health insurance in the United States and here in the United Kingdom, where it comes out of direct taxation.
Yeah, Sean, it's interesting, that distinction, because obviously we here in New York have been reporting on what feels in many ways very similar with a nurses' strike here. Tell us, because that one is so much more widespread, because it is a nationalized system, what impact is this strike expected to have on what Errol's detailed as an overburdened healthcare system?
Well, it's pretty significant. I'll give you an example. A couple of weeks ago in London, I jumped on and detained a robber who targeted me, stole my phone, and I possibly cracked a bit of my elbow. When I went to the emergency departments, the queues were 10 to 11 hours. And since I can grip okay, I think that's probably okay. I'm sure that would be the advice of a doctor from Maryland originally.
Yes,
Andrew,
Baltimore.
how are you doing, sir? Well, you're live on CBS in New York, where, by the way, we love the cheesecake.
Oh, excellent cheesecake, excellent pizza. I miss New York pizza, yeah.
Now, you're a doctor, you're not a nurse.
I am a doctor, yes.
But your
yes.
colleagues, why are they unhappy?
So we're seeing strikes across the health service here. 75 years ago, the United States made a bad decision of not choosing a system like the NHS. And
I think you've just caused a massive debate on CBS, by the way.
No. I think a lot of Americans would agree. There are tens of millions of Americans without health insurance. People who do right, who save well, who have a good job, and then suddenly a family member gets ill, and suddenly they have to fundraise on the internet to survive.
But you know what the situation is like.
I think in the wealthiest country on the planet, that's barbaric.
No, it's but you know what it's like in America. People will be watching this now, and they'll be using all sorts of pejorative terms about you and British people talking to America about a health service and somehow saying it's better.
Yeah.
But from an American perspective, leave aside political ideology, at its best, what is the NHS?
Well, at the NHS, everybody pays for it with their taxes. And what I love about being a doctor here in the UK is that when I see patients, I treat patients and I don't have to ask for their credit card. I don't have to worry about how they're going to pay for it. I don't have to worry about giving them a substandard treatment whereas a wealthier person might be able to afford some different medicine.
Is this why nurses are paid so badly, though?
Well, look, I think for the last 15 years, we've seen our nursing pay and doctor pay has dropped by 30%, and so now we have half of our hospitals are setting up food banks for NHS staff because we just can't afford to live.
That's crazy, isn't it? And we'll explain. Obviously, people know what food banks are in the States. These are professionals, very senior nurses, and indeed junior doctors. Because here's another thing, CBS guys watching. We face the possibility of a junior doctor strike with the British Medical Association ballots if junior doctors don't get better pay. So watching from overseas, saying the National Health Service is better, people would think we were talking nonsense.
Well, it sounds like nonsense, but look, 10 years ago, the NHS was ranked the #1 healthcare system on the planet. The Commonwealth Fund ranked us the #1, the best healthcare system on the planet. It was the most efficient. We spend half the amount of money that the United States does per person on healthcare, and we do it in a much better way. We just need a government that cares about it, that values our work and values our labor.
Doctor, I'm going to leave that debate for CBS viewers to have. You can tweet CBS, because I think this is a debate that people are going to have very enthusiastically engaged, but this is about whether the National Health Service that is funded through direct taxation is meeting minimum service levels of staffing, and whether it's attractive enough to meet the retention and recruitment targets that are needed if we're not to wait 11 hours for possibly cracked elbows. Back to you.
That's absolutely, yeah, so fascinating,
Sean, I hope they find the guy who tried to rob you, but our thanks as well to the American...
Well, I detained him for 6 minutes.
Good for you.
You know, a really interesting discussion, and we appreciate you bringing in what is an American-born doctor there working for the NHS, making the argument that it may be more effective. That's what's in the States, despite the protests.
Right, because, and that's what's so interesting, because seeing those images, you think, well, that's a system in chaos, it doesn't work, and to hear that doctor still advocate so vociferously for it. All right, Sean Dilley, appreciate it.
Sean, thank you. Get better.
Thank you. And thank you, Doctor.
Of course, thank you.